Hello, I'm Michelle Sweeney, and I'm a member of the board of the Friends of St. Nick. We are here tonight with Dr. Sal Perla, president of Norwood Hospital. Thank you so much for being here.
Thank you for having me.
COVID seemed to hit Norwood pretty early. How did the hospital handle this?
So Norwood Hospital was impacted relatively early in comparison to others due to our ties with the Biogen conference, and then of course the town hall. So we started seeing COVID patients earlier than others, and we had to very quickly adapt almost independently just due to the geography. And we very quickly utilized those skills that we've been training for years and decades that we never really thought we would have to use. It was always emergency planning, but got our tent up, did the emergency training with our staff, refreshers, and then of course had to gather all that necessary PPE to safely take care of our patients and keep all of our staff safe.
During the beginning of the pandemic, the hospital was able to offer a lot to the residents of Norwood. What were some of those offerings?
So for us, I think what was probably most important is, obviously we had our emergency department. And then within, I want to say, a week of us realizing COVID's real and it's hitting us very quickly, we put up the tent. And that was a tent that was utilized to screen patients. And we were able to screen patients very quickly and safely. And we went from 0 to 100 patients a day overnight. So I'd say that was probably the most important thing that we could quickly do to help the community.
And how did the staff handle the changes at the hospital?
We really had to get the staff educated to be prepared so that they can safely take care of the patients. And that process to do for, Norwood's a good sized hospital. It's 230, 240 beds. We've got, close to 2,000 staff members. So we really had our work cut out to train people very quickly to be able to take care of the community.
That's great that you have such an amazing staff at the hospital. During the pandemic, you also worked really closely with a number of different departments in the town. What was that like?
It was excellent. So I think the local Board of Health, working with Segal Reese and her colleagues was outstanding. So our COVID testing center was at peak 150, 160 patients. And we were able to call back patients with positive test results the minute they came back. And then we'd work with local Board of Health to do the contact tracings. So for us, it was a really homogeneous process to make sure that if you were in fact positive, the information got back to you very quickly. One, by us, and two, by the Board of Health for that contact tracing. And our process was so successful, we had people traveling from Arlington and Cambridge coming to our testing center because we were really good at what we were doing. And
just as things slowed down for the summer, the flood hit. Can you walk us through what that was like and how that affected the hospital?
Yes, so if COVID wasn't challenging enough, we had to deal with a flash flood in Norwood, which who would have thought a flash flood would happen 10 miles outside of Boston? And I can remember getting the call, and it was just, it was a lot, very, very concerning. You could hear the nervousness in the nursing supervisor's voice, and it was just, this doesn't feel right. We've definitely seen large storms before, but it's coming from all angles. The roof is shaking, the groundwater outside, we can see it, it's rising. And I think for the staff that day, it was nothing less than complete terror. I mean, what they experienced, no one should experience. And while that day was a very difficult day, what the staff accomplished was nothing less than a miracle. I mean, we were lucky. We had a very busy discharge day on Friday where we discharged almost 50 patients. Otherwise, we would have been well over 200 patients in the hospital. But we discharged 175 patients from this facility, coordinated with, I don't even know how many towns. I'm going to guess 15 ambulance services, towns, EMS, firefighters. and we had 0 incidents. We got 100. I mean, these people are non-mobile. These people were, very ill, and we were able to get everyone safely to another destination without incident, and I'm thankful that none of them got hurt.
We have covered a lot in such a short period of time. Is there anything else you'd like the residents of Norwood to know?
I want to thank everyone for the letters, the emails, the phone calls, the commitment to the Norwood Hospital. All our staff, whether it's nurses, doctors, lab techs, x-ray, rehab, food service, you name it, it doesn't matter. But the commitment from all of them, because in the beginning we didn't know how long this was going to take. We thought, well, it'll dry, and we'll be back. And people waited a long, long time thinking they were just going to come back to their home. And Norwood Hospital, to our employees is their home, but also to the residents. So we want to thank all of them for their patience. All of the kind words of how you miss us and what Norwood Hospital meant to them, to us, is just, it's emotional, it's wonderful to hear. It's sad at the same time because we're not here, but we can't thank you enough for all those kind words, and we can't wait to get back to being able to take care of you.
Well, Dr. Perla, thank you so much for coming here today, and thank you so much from the entire board of the Friends of St. Nick for all that the hospital has done for us this year.
Thank you. It's all the staff that really should get that recognition. They are nothing less than remarkable.